So the oxygen saturation you are presented with is 99%. And many go like, oh, this is easy. This is why this airway of the patient is very dangerous. You are handed this case. You have a 25-year-old male who was involved in a trauma. It was a head trauma. Currently, the patient's Glasgow Coma Scale score is 7, and the patient is breathing on his own. The oxygen saturation is 99%. The question is, do you intubate or you don't? The answer is that you've got to intubate this patient. You've got to do it. And here is the part that most people miss. The airway decisions we make in our board exam are not based on oxygen numbers only. They are about protection. Protection of what? Protection of the airway, right? At a Glasgow Coma Scale score of 7, the protective reflexes of the patient are unreliable. The gag reflex has weakened. At this time, the tongue is likely to fall back. Secretions are likely to pull into the patient's throat. And if this patient vomits, aspiration is going to happen silently without you even knowing. And there's no warning alarm when it comes to aspiration. The monitor will stay calm until it doesn't. So oxygen saturation is usually a late marker in these kinds of patients, and loss of airway protection comes very early. And the real question is not, is the patient hypoxic? The real question should rather be, can the patient protect their airway? And if the answer is no to the fact that the patient cannot protect their airway, then you have to secure the airway before the monitor changes that the patient's oxygen saturation is dropping. Because by the time it changes, you are reacting and you are not leading. And that is why you want to intubate patients whose Glasgow Coma Scale score is less than 8.